Hi, today I'm going to be demonstrating how to take proper blood pressure. First, you want to make sure that your patient has not had any caffeine nor nicotine in the past 30 minutes. Assure that your patient has had at least 5 minutes of rest prior to taking the blood pressure. You want to sit them down with their back completely straight on the chair, supported. You want to make sure that the feet are shoulder width apart and flat on the ground. You want to make sure that the arms are supinated and at heart level. We're going to take the blood pressure on the left arm. Now, when choosing your cuff, you want to make sure that it's the appropriate size and make sure that the artery mark is on the brachial artery. To assure that you have the proper size, you can view here. If you pass this line, you'll have to use a smaller cuff. If you pass this line, you'll have to use the larger cuff. When placing your cuff, you want to make sure that where you're going to place your artery mark is right where you feel for your brachial pulse. When placing the cuff, assure that you have space of 2 fingers under the cuff and the space of 2 fingers above the crease. When you use your stethoscope, you want to make sure that the prongs are facing away from you to ensure proper hearing and to assure that the diaphragm is completely tight. When you place the diaphragm on the arm, you want to make sure that you use your non-dominant arm, placing it with your index and middle finger on each side. Place your gauge at an appropriate distance and viewing point. Assure that it is tightened to the right all the way, but not too tight so that you don't have issues untightening it. As you increase the pressure, you want to make sure that you only go approximately 200 millimeters of mercury and release approximately 2 to 5 millimeters of mercury per second. You will be listening for the Korsakoff sounds. The first one will be your systolic and your last one will be your diastolic. So I got a reading of 110/76, meaning that she falls under the normal range of blood pressure. Thank you.